Ladies and gentlemen, join me in welcoming on stage Anand Mani, the Managing Director of Anand Mani Consultancy LLP, and a veteran interior design professional with expertise in the hospitality sector. He will be starting the program. Today's program is all about health. We start with holistic health, integrative approaches to life, optimization and healing. And he will be taking the program forward. Kindly put your hands together to welcome our moderator, Anchor Anand Manike, who will be joined on stage by Dr. Vishnuraj Prakash, Head of Ayurveda, Tulah, Clinical Wellness.
Good morning, everyone. Welcome to the second day of the 14th edition of TiEcon. I'm straight away moving on to this great session of today's fine morning. As you all know, our CM, Charter Member Faisal Kotikolens, KEF Holdings, is on a very new initiative which has already moved forward. Tulah, a holistic wellness clinic in Calicut, of course in my hometown and of course in our own Kerala. Faisal, as you all know, is a visionary leader and he has always been driven by all his initiatives for a transformative purpose. He often innovates and disrupts each and every activities of us for a positive impact. From the start, he had his pioneering Emirates Technology Casting Initiative to the remarkable PRISM program of Nadakawa School, which even 2 weeks earlier opened up a similar school in Jammu and Kashmir, and the creator of Maitra Hospital and many other infra engineering innovations. Maitra Hospital, as you all know, is an advanced patient-centered hospital, and each chapter of the life of Mr. Faisal is all about building systems and uplifting the lives. That is a initiative and that is a uniqueness of Mr. Faisal. Tulah is his next step, and in this journey, he is bringing the ethos into the world of holistic living and human transformation. And in this mission, we have none other than Dr. Vishnuraj Prakash, who joined Faisal to uncover the essence of holistic health. Dr. Vishnu is an Ayurvedic physician and a wellness leader who's focused on integrative root cause-based care, and he works at Tulah to shape chronic diseases and the lifestyle reversal programs that really integrate traditional medicine with modern science and diagnostics and functional medicine. And his purpose is aligned with a larger vision to create a model where traditional wisdom and contemporary science work together to genuinely transform lives. So good morning to you, Dr. Vishnu.
Morning, sir. Morning.
So let's start with one common question which everybody needs to have an answer, and then you can straight away go to your presentation. You have managed to start on a very clean slate in Calicut, and you have started something quite different, not only in Kerala, but for the whole of India. How was the start from ground zero? If you can just give a brief sneak preview into that thing, and then we can go on to the presentation.
Yeah, so our chairman, Mr. Faisal, is a very passionate individual, and he always believed in identifying problems and to give solutions. So during COVID times, he had this land, you know the history about the land, and he envisioned that there should be a bubble for him and the family so that during these trying times, they can actually create a sustainable environment and live there. But eventually, he started understanding how fragmented healthcare, delivery has been done. And we were into healthcare business at that time. he decided that he has to create a model which is for transforming lives. And that's how last 4 years, we have been brewing or curating this concept. And we firmly believe this is the way forward for holistic health. And thank you so much for the kind introduction and also for this opportunity to share our thoughts on how we reimagine holistic health and how it's manifested, Tulah.
Prakash, that gives a very quick intro and start into the. So over to you for your session
Thank
and
you.
your presentation.
So we as a company always believed in being different and making a difference. And that's what we were doing in the last 30 years. And it was driven none other than our founder, the KEF Holdings Board, driven by the leader, Mr. Faisali Kutikolan. And his mission was always to find solutions on problems to transform life. And this is how we also reimagined health. And we created a space in Calicut, a sanctuary, which is called Tulah. Tulah is a Sanskrit word, means balance. And I would like to invite your attention to the visual so that you get a context on how we are doing it. Can we have a video? So let me actually dive into the subject of this holistic health and share our thoughts and ideas about it. When you look about the history of how holistic health has been developed or understood over a period of the last 100 years, holos is the Greek word which means whole, and from there we have actually derived this word holistic. And the first usage was done by Jan Christian Smuts. He is a South African soldier, a natural science student. He wrote a book called Holism and Evolution in 1926, where he first referred the word holism. From there, the modern era has actually taken the word and the holistic health was defined, and WHO has also vetted it down during the 1948 conference. In the preamble, they have mentioned health is not merely the absence of disease or infirmity. But centuries back in Indian tradition or traditional wisdom or sciences, health is much more beautifully defined. So Sushruta, the father of surgery, is a renowned physician in Ayurveda. He has defined this holistic concept long way back. The balance of metabolites, digestion, tissue, excretory channels, along with a joyful soul, sense organs, and mind. When you closely observe the definition of WHO, they have just told about not merely the absence of disease or infirmity, but a complete physical, mental and social well-being. They couldn't actually crack the know-how of soul or a joyful soul or a joyful sense organs. What we have seen over a period of time, something which is occult, something which is not known to your eyes, something which is not having evidence, it's often neglected. And that's what is exactly happening in the holistic health space in India also. So let's analyze the current landscape, understand where we can improve, or what was our thought process when we were actually curating this concept for Tulah. The most important thing what we have to understand is we are having a lot of trends. We have abundance of trends, but still we can see that people are suffering. And there is a data to it also, we'll come to that. The most important point of why these trends are not giving solution is the fragmented way of delivering it. So any wellness model when you see, it's highly fragmented. The delivery process is not unified. There is no unified protocol. When Mani sir told that this is a gift, Tulah is a gift from India to the world, we really mean it because India is the one who can lead this concept across the world. And we have a huge gap there, and that's why we have, manifested Tulah at Calicut. Holistic is often an overused word without meaning and essence to it. You also know about this. Any place in Kerala or India where they deliver some traditional, experiences, it's called a holistic destination. But then, is there deep-rooted science and evidence to it? This is something which we have to understand. Standardization in training and competency is lacking. This is really important because to move forwards to deliver that quality care and healing, we have a huge gap in this region to be corrected. We need unified clinical protocols. Like I said, all these specialists work in silos. What often we see is if you have health concerns which is chronic in nature, you go to a medical doctor. That's the primary healthcare choice that we have. And over a period of time, maybe 10 years, they are on medication, they find that their health is going down. They go to a traditional medicine specialist. They'll go to the yoga, then they go to a naturopath. This is the problem. There is no system which is driving or bringing these people together so that they can sit together and give a solution to you. And this is what we do at Tulah. Most of the establishments when you see, or the model or the delivery model which you see, there is no outcome measurement which is there. If we have to move forwards and be on top of a game from a country perspective when it comes to health, I think we should start having extensive research in holistic health, especially with integration of strengths of available systems which we have in our country. Misinformation and pseudoscience. There are a lot of vested interest and narratives which is there. Again, due to the fact that I'll give an example. Apple fell down. If Isaac Newton didn't notice it or didn't think about it, there is no universal law of gravitation, and that has changed the whole, or opened up a whole new arena for exploration. Often what happens is if you don't know the current scenario, thinking is less, criticization is more. If you don't know about something, it's often discounted. But I think we should have research. We should have research focused on understanding or unveiling how traditional medicine works, how it can actually work together with modern science. There are a lot of work already happening, but still what I'm trying to say, the amount of research and funding which has happened in the conventional medicine compared to it in the last 60 years, and what we are doing is, it doesn't have that justice. There is a lot of discrepancies there. Documentation and clinical workflow is really important. Most of the centers are already started doing it because right now traditional medicine is into an era of evidence-based healing, which is really a good thing, but still, it has to come in index. The documentation should not be only looking at retrospective studies or case studies. It has to come in as a clinical trials, which is very much scarce when it comes to real delivery of holistic care. Unrealistic expectations of the people, like I said, they have a chronic condition, 20, 25 years, they have actually suffered through, suddenly their health is going down, but they want quick fixes when they come to a holistic destination. That's not realistic. Cost and accessibility is another challenge. If you have to give that real, genuine essence of holistic healing and integrative care, the cost goes high and accessibility will reduce. So these are the things that, as entrepreneurs, whoever has thought process in venturing into this space, how we can actually optimize it. Cultural misunderstanding or again awareness. Often these concepts in traditional systems are discounted, like dosha. It has an in-depth meaning, but nobody is transliterating into ideas, which is very much connected to modern way of thinking. Now, Ayurgenomics is a new subject. I had the privilege to meet Professor Dr. Mitali. She is one of the pioneer scientists in this field. We in fact have a MOU with IIT Jodhpur where we have enrolled into a contract or agreement in identifying scientific know-how when it comes to Ayurvedic constitutions and imbalances. They're doing wonderful or remarkable works, but still there is no unified effort towards research on this area. Talent retention and interdisciplinary leadership. This is also really important. Increasingly we can see that the experts who are working in silos, they are really comfortable in what they're doing. But the leadership has to understand and their thinking has to change, because this data is going to be really interesting for you. 2020, the global wellness economy was $4.4 trillion. It's a whooping number, and it's going to, as you know, 20% is a CAGR. It's increasing every year. And I want to bring your attention to the traditional and complementary medicine contribution to this revenue, which is about $413 billion. This is the recent survey. Now, as we speak, the Global Wellness Summit is happening, and the 2024 data is going to come out. But 2023, the wellness economy is improving at the same CAGR, but the traditional and complementary, it's contracting. It's only $533 billion in 3 years' time, which is only a 33% growth. Why it's happening? It's the lack of evidence. The modern world would like to understand and become aware of what is happening with them when they go through this process. So the primary choice is always into a reductive, quick fixes, what they want. If we have to change this, we have to bring that awareness at a global level, at a policy level, on how an integrative or bringing these strengths together can change their lives or transform their lives. So we have to revisit the roots and bring evidence to healing. This is what we thought. So by the way, all this research is not only the internet data. We have engaged a company called Focus 360 4 years back, and it's a McKinsey partner, and they have actually did a research and given this data. So this formed the fundamental, aspect of how we curated this sanctuary at Calicut. The root cause is really important, and I would like to bring your attention to again a traditional, science quote. Dhi dhridi smriti vibhrashta karyat kurude karmam prajnaparadam tam vidya sarva dosha pragovanam. So the deterioration of insight is the root cause of majority of the problem. I'll give examples. Smoking is injurious to health. People still smoke. Alcohol is injurious to your liver. People still drink. The most evident example, and this is it's a serious problem that we have to really think as the leaders. At home, when you ask your child to come to you, I don't know how many of you have experienced this. Their focus is not on that call. Where in the previous times, if a parent is calling, they will go to that parent. Why? Because there is a lot of information overflow and stimulation from the internet, or it's all information. There is no disciplined processing of that information. And what happened is eventually they are going into an attention deficit spectrum. And it's told in Ayurveda, Dhi dhridi smriti vibhrashtam. That means something which can cause the anomalies or imbalances in your intellect. Intellect is not intelligence. Intellect is something beyond that. Willpower and memory. And that's what is exactly happening to this generation. They don't have decision-making skills. They don't have, the focus. So insight will gradually deteriorate. And that's how many of the times when you have to do the right thing, there is no right thing. There is always a gray area. This is one of the cause or root cause of all inflammatory responses in the body. And that's what we have actually curated a journey which definitely looks at intellectual enhancement. We'll get into the program details. So like I said, this is the global state of health. 8 million tested population, 60% is going through one or the other lifestyle condition. Why? We have the best healthcare infrastructure, right? But still we are failing here. Because the focus is always towards acute disease management, infection control, transplant, surgeries. What needs to be proactively done? So healthcare is, as you all know, is becoming a very reactive space. If I fall sick, I'll go to the hospital and get cured myself. A leadership thinking should be different. We should be proactive. The same you will do in your business. You will have multiple analysts looking into the numbers, and if you see the numbers going down, if you see the S-curve going down, you will have change of strategies. I think we as human beings, we have to take care of our health, because without health, health is wealth. And in Ayurveda it's told, Sharira madhyam kalu dharma artha sugha sadhanam. If you don't have your body, or if you don't have the physical existence, you will not be able to get dharma, artha and sukha. Dharma is the righteousness, artha is the financial implications, and sukha is the happiness that you get from it. And it's told in Ayurveda, you follow Ayurveda, you will get dharma, artha, kama and moksha. So all this wisdom is all there, but then, it's not getting translated or shared properly with evidence to it. So we thought thoroughly, and we understood that the future of healthcare is an integrative stance, bringing in the strengths of all available science and carefully curating with evidence connection. So the functional diagnostic and biochemistry is what we do to understand the baseline at Tulah. Connecting that with the elemental imbalances or the doshic imbalances, or when it comes to Chinese medicine is elemental imbalances, and then connecting with the blood markers that we do. Understanding the importance of neuroplasticity, the gut, the effect of gut into the different axes because of that, whether it's brain, whether it's immune response. Assessing the sleep through technology. So the technology integration is really vital to collect this evidence and show how that healing is happening. Monitoring the circadian rhythm. You have to understand we are all diurnal human beings. So I am seeing a lot of seats vacant because we are gradually going to being a nocturnal being. We would like to be in the dark. You have to think properly. This is a subject that we have to really thoroughly brainstorm together, and more and more conferences like this should happen and discussions should happen, because we should raise or wake up with the sun, energize ourselves, do some exercise and get on with our life. By sunset, you have to gradually tone down and get to sleep. Sleep is considered as one of the most important pillar in longevity. And longevity and biohacks, again, when we started, we are talking about trends. We are in the most abundant phase of the, when you see the industry of development of these trends. But then the rhythm is really important, and circadian rhythm for us is, we are a diurnal being. There are different kinds of rhythm. There is ultradian rhythm, infrared rhythm. These are all natural vibrations which is attuned to our own body. Like the universal law of gravitation says, Sir Isaac Newton told that, depending on the mass and distance, objects attract each other. So we are all part of one microcosm which is connected to a macrocosm. These are all philosophical thinking which was there eons before. Sir Isaac Newton discovered the universal law of gravitation. Psychometric tests. Often talking about psychiatric assessment or psychometric test is a taboo in our society. We have to change it. Increasingly, I work closely with a lot of medical specialists, and one of my close, friend who's a psychiatrist, she was telling now the shift is happening because parents are seeing that their children is not sitting in one place. They are not listening to them. They don't have focus. Speech is getting delayed. Why? because of the over influence and stimulation and information which we are giving to a small brain, which they are unable to process. Again, deterioration of insight at a parental level so that the child insight is getting lost. So psychometric tests we have introduced there because any disease, any problem, anything which can give that unhappiness to you, it's related to a psychological imbalance. So that's why we have a full-time clinical psychologist also at Tulah. All this is to identify the root cause, and it will not be, it will not be narrowed down to one tissue level. It's so holistic. So we do like the reductionist approach when it comes to diagnosis and finding the tissue involvement, cellular involvement, going deeper level. But true holistic health is much deeper than that. And when we work in that level, in balancing those elements and energies, the whole person is getting considered there. Evidence-connected awareness is what we do at Tulah. So after getting all this, fundamental baselines, we look at integrating principles or practices or therapeutics from, various aspects. We have actually, given you the traditional medicine interventions here for your understanding how we are bringing in a high-level thinking. Ayurveda, circadian rhythm, and biology is very much connected. Genomics has found that the constitutional, I don't know how many of you have heard of this Vata, Pitta, Kapha. Now it makes sense because it has a genetic expression. There is a human HLA gene, I forgot the abbreviation of it, which gives an genetic expression which is very close to the characteristics of a Vata predominant person or a Pitta predominant person and a Kapha predominant person. The research was done by Dr. Mitali, and they found that a fire predominant person, a Pitta predominant person can actually be very comfortably living at high altitudes than a Kapha predominant person. And it's told in Ayurveda also when they are describing this constitution how a Kapha predominant person cannot tolerate cold and how a Pitta predominant person can tolerate much more cold. The idea is to optimize life, and life is a process. There is no quick fixes to it. And this is what we have to start bringing awareness to ourselves and the new generation. It's a continuous process, and there should be a frequency match which we have to always, bring in when it comes to living in this nature. There are transient changes which is allowed, and that's how life is. There is no constant. It's always a transient change. The moment you reach that transient change, you will be prone to diseases or imbalances which can bring in that unhappiness and which can affect your insight. Let's have that proactive response, and that's how we have decided that we have to create a space where science is meeting soul and healing is transformational. We have infused till now $100 million into this ecosystem. We are so much committed into research. We want to holistic health as a concept should be led by India, and we have only we have these resources. I think we should really appreciate that and take this opportunity and tap into that $8 trillion to $10 trillion economy. But let's do it right. Let's not do it fragmented. So looking at, when Manisar asked me how the inspiration started, our chairman, Mr. Faisal, got deeply committed to this cause because he went through his own health concerns. In fact, what you're seeing is actually the MRI images, and he was diagnosed with a condition called cervical myelopathy. If it's untreated, you will get paralyzed if it's untreated. So it's a serious issue, and always beyond a point, surgery is the recommendation. So he was diagnosed, he started developing numbness in his fingers. He was diagnosed about it in Singapore Hospital, Royal Health Hospital, and the neurosurgeons there recommended surgery, and that's the only way. He came back, he went to Kottakkal, and he started doing research. He's an avid yoga practitioner since the last 20 years. He understood that yoga also should be done more clinically. It's not like if you're having health issues, the whole practice of yoga should be different when compared to a person who is healthy. So he put a team together, and we all worked. Fortunately, I got an opportunity and to be part of the team, and we along with the neurosurgeons, the neurologists, yoga specialists, nutritionists, fitness experts, sound healers, it will be interesting for you to know. We all put together a plan by understanding the baselines. Whatever you have seen before, what I've explained is actually his journey. We looked into the whole data and curated a program, and you can see in 1 year time, he got reversed. In 2 months time, his symptoms reduced. You can see that on the right side. And this is the myelopathic patch, this white shade which is there, and over a period of time, it has reduced. And now he has minimal symptom, and these are all done in the same hospital, the Royal Hospital, Singapore, and his neurosurgeons told that now we can wait. Whatever you're doing is working. There is regenerative changes happening, so continue whatever you're doing. So he is still on continuing that holistic approach. So this what was his real holistic, intervention. And that's why we were so committed to bridge the two worlds. We want to bring in soul to the science. We want to bring in vitality to longevity. We want to bring in wisdom, evidence to wisdom. And we want to bring in direction with data. This is really important because there are a lot of fragmented data out there. We have to put it to good use to bring in evidence to the wisdom and the traditional medicine. So that's how Tulah is existing, and Tulah is not a retreat from your life, because this is really important. Why? Most of the people, when they actually have problem, retreat from their normal life and get into a space for healing and again go back. We don't believe in that. Tulah is a place where you should come, and we want to transform your whole life. We want to bring insight to you. We want to, get into a rhythm which is going to be sustaining or bringing that quality of life throughout your life. So the Tulah journey has 4 important pillars. We'll go through that. It starts, before we go into the journey, these are the different offerings that we have currently at Tulah, and we carefully curate all this offering. It starts with a lot of diagnostics, including genome studies and microbiome analysis. Then we have clinical. So we have a clinical and surgical procedures which can be done. We have an OT there, and our surgeries is different from what generally in hospitals do, because we do a pre-hab and rehab. That means you come for by the way, surgery is not acute surgeries, it's more of elective nature if we feel that a surgery is required. So we do a prehab wherein you prepare you for the surgery, and then do a rehab to actually effectively get you out from that process. Sports medicine, Ayurveda, Chinese medicine, Tibetan medicine, functional medicine, yoga, fitness, emotional therapy through clinical psychology interventions, meditation, sound for healing, all these aspects. So it starts with diagnosis, and in-depth diagnosis through the different diagnostic tools we have. We have on-site all imaging studies. We have functional biochemistry analysis. We have the gold standard for testing many of the, or screening many of the risks. What you are seeing in the image is a cardiopulmonary exercise testing machine. Eventually, in the first 48 hours, the idea is to bring in the Tulah Life Index score. Tulah Life Index is a patented algorithm for us. It's patented in 183 countries. It's a one-looker number to understand where you are standing in your health. The score, if it's 50 and below, either you're already diagnosed with the disease or you are in the process of manifesting something. Between 50 to 70, you are in a safe space, but you still have to improve. 70 above, that means you are in a better space, and you can continue to do what you're doing, which can positively uplift your health. We go through the 7 areas: muscle health, cardiorespiratory health, immune health and inflammation, gut health, stress management, quality of life, and lifestyle risks. These are being assessed in the Tulah Index. Then all the data coming to the specialists, we have a team of multidisciplinary specialists. They assess this data and then make a program. This is the healing phase. So we have diagnosis, assessment, and healing phase. Healing at Tulah is actually, whatever data has been assessed, all the team coming together, we call it as the multidisciplinary team meeting. Then they curate, or they debate on what best needs to be done to address that problem at a root cause level, and then come up with a program which has majorly 5 modalities. We have hands-on therapies, we have personalized nutrition, we have mind-body energy modalities, or balancing, mind-body energy balancing modalities, regenerative and biotechnology modalities, movement and performance modalities. So this is how the whole program has been curated. I would like to bring your attention to an enhancement from an Ayurvedic experience point of view. Again, experiences are important. Even right now in healthcare, experiences really matter, because already you are in a space where not that well, and if your experience is not good, you will not be able to actually continue that process. So we have enhanced the whole Ayurvedic delivery model by this patented Vichy shower bed. We have integrated a Vichy shower, which is a warm water shower, into a bed which we have designed, and it's a 100% antibacterial and antifungal surface, and all the therapies is done on this bed. In Ayurveda specifically, when you see any fermentation therapy should be followed by a warm water shower. So the whole therapeutic experience is enhanced with this, and we have already patented it in US, UK, Saudi Arabia, India. The patent has been filed. So this, the remarks or the feedbacks what we get from, again, put into research and identifying the whole, it's a game changer when it comes to the service delivery model also. What is lacking, again, what we understood is the sustainability part of it. Again, like I said, people are doing these interventions as a quick fix, because quick fix is a thought or reactive approach to health is what is always there with human beings. We want to make sure that they're sustaining it. That's how we have integrated technology to it. So we have an app called Tulah app. Everything from end to end. The moment you are enrolled or registered as a individual with us, how the journey is being programmed at Tulah holistically, how it has to be continued. We call it as home routine, wherein 24/7 specialists are available for your concerns to be addressed and guiding you further. So the continuum is really important. This is a major gap in current holistic healthcare model. Let's explore now the sanctuary, and I'll show you a sample of how a journey has been crafted. We call it as the Tulah rhythm, but it has a huge impact on your health. Again and again, I'm telling, the circadian rhythm is something which can change or bring in balance to the transient changes. The more and more you move away from that natural rhythm, you will go into concerns. If you have existing conditions, I think you should be an early morning person. Don't make yourself awake at night, sleep on time, and I'll show you the Tulah rhythm. The whole sanctuary is 30 acres. We have 14 therapy areas, 1 sonarium, 65 suites, 2 restaurants, and 1 experience center. The journey at Tulah starts early in the morning. Many of you might have read the book, The 5 AM Club by Robin Sharma. Before, again, centuries back, it's told in Vedas that you should start your day at Brahma Muhurta, which is not even close to 5 AM. It is 3:30 AM. There is a reason to it, because that time there was no electricity, there was no artificial lighting, so people were forced to go to their dwellings and rest by sunset. So early morning is really important because there is a natural process which has been conditioning. Now we have evidence on the serotonin, melatonin, cortisol balance which is required for the wake and sleep cycles. So it starts with the sun gazing. We have an enchanted forest at Tulah wherein you start your journey at Tulah. The Tulah rhythm starts, you go to that place, do the sun gazing, energize yourself, do a walk or jog to have that warm up, improving circulation through the tropical forest theme healing gardens. And then you continue with your yoga practice. If you're healthy, we will have multiple yoga destinations. What you're seeing is actually a tree deck yoga. But if you have some concerns, we highly recommend the Iyengar yoga way. We also have fitness as a modality if you're more attuned to fitness, but we strongly recommend yoga because yoga can integrate mind, body, soul when you're strengthening your muscles and aligning your body. We have multiple rehabilitative protocols for better recovery. What you're seeing is a cryotherapy treatment. All the spaces are designed in such a way that it enhances your awareness and learning process. We have a concept called farm to life. Farm to table, farm to fork, very similar, but we use life because food is, Hippocrates in long back in Greek medicine has told, let food thy medicine and medicine be your food. And the cuisine concept at Tulah is curated by a multidisciplinary approach. And we have a lot of herbs and we have fruit orchards, we have vegetables. We engage also the community farmers to give us organic products. fish, and all these stuffs. Aqua body works again for rehabilitation. Chinese medicine interventions wherever applicable. By the way, integration doesn't mean that you have to do everything. It means that what best needs to be done for you for that particular root cause, that needs to be adopted. That's where the multidisciplinary team meeting is really important. Ayurvedic therapeutics, soulful meals, again, food is medicine at Tulah. This is what the most important thing which I would like to highlight. If you remember, I've told the root cause is lack of insight. Why we are having lack of insight is the lack of intellect. And Vedanta practices or principles are actually something, or it's kind of a learning process wherein you can enhance your intellect. And we have full-time Vedanta preachers at Tulah, and Vedanta is part of the Tulah rhythm. Medical nutrition, if you're going through deficiencies, you have to correct that deficiencies to get that functional physiology corrected. So we have facility to do the prescribed medical nutrition wherever required. We have a OT facility, elective surgeries if required can be done. Hyperbaric oxygen chamber, again, wherever we find oxidative stress as the root cause, this therapy will be introduced to them. We want them to feel at home, so playing and working is a concept that we have at Tulah. A lot of game option which is there. Meditation, so towards the evening we will wind down with the meditation. There is sound for healing, so that we prepare you to go back to your restorative suite for your restful sleep. And that's how we perceive or manifest holistic health at Tulah. And we strongly believe the true essence of holistic health is that integrating modern science and traditional wisdom with root cause identification or clarity, proactive stance towards prevention, personalized pathways to healing. In this way, we can restore that coherence to the fragmented life. And the sanctuary is designed in such a way that this can be achieved, and this is a model to the world. And as we proudly say, this is a gift from India to the world. And let us be more insightful to life, and that's a message that if I can give, you can all take back. And thank you so much for this opportunity to share our thoughts on holistic health. Wish you all good luck and have a good day.
Thank you, Doctor. I'm quite sure that session has resonated well with you all, the entire audience, and you might have had great takeaways and amazing time, and you have accomplished a lot this fine morning. We need to summarize in the interest of time, but I will just take one question with you, Doctor. All set, you gave a very detailed narrative regarding Tulah, regarding wellness, regarding clinic and all those things. Finally, can you just guide us in making choices in our daily lifestyles that will ultimately lead us to lead a very happy, proud life in 1 or 2 sentences?
So again, getting into the roots is really important. Culturally and fundamentally, when we look at our life, the purpose of life is really simple. You have to achieve 4 things: dharma, artha, kama, and moksha. I'm bringing in this Vedanta, practices. Whatever you see in the world on life is derived from this fundamental root concept. And for that, health is required. For that, your choices really matter. The choice is never gray. It's always black and white. You have to be firm with your decision when it comes to health. And it should be a stance that all of us as leaders should take, that health is first. Because without that, you will not be actually choose whether what is right or wrong. You cannot follow the righteous way of living. You cannot have the energy to actually, to achieve things so that your financial aspirations are not met. You might not have that energy to attract people. You might not be able to achieve that love and, affection in your life. And eventually the concept of liberation, which is attachments, are the root cause of all sufferings. So if you want to be free, I think for that, all these aspects is rooted to that thinking, the insight which we have to develop so that you don't do prajnaparada, which is that intellectual blasphemy. So discipline is the key. Consistency is the key. And as leaders, we should spread that idea of being disciplined, being consistent, and making the right choice, doing the right stuff, and seeking the right guidance so that we can be healthy as always.
Discipline and consistency is the key. We need to summarize in the interest of time, but I can take one. Is there any comments, reflections, or opinions or questions from the audience? Just to be or doctors available here. You can take it even offline. So it was a pleasure to keep this session going, but due to paucity of time, I need to wind up. Grateful to you, Doctor, for this
Thank you,
excellent narration, and to the entire audience in particular. Back to you, Nisha.
Thank you so much, Dr. Vishnu Prakash and Anand Mani. To present a token of our appreciation, I invite Charter Member Johnny Paul, Chairman, Popular Vehicles and Services.